welcome to another question and answer session. This is the physiology portion. A 23 years old man stabbed in the groin develops hypovolemic shock and develop hypovolemic shock. What is the most likely findings analysis of the urine? So in case of hypovolemic shock, what changes in the urine? Here the options are the decrease specific gravity, increase specific gravity, increase urinary glucose, increase urinary protein, increase red cell in the urine. So first of all, let's see what happens in the hypovolemic shock. In case of hypovolemic shock, that means when there is blood loss, their hypovolemic shock develop, and some of the special activity activated. First of all, here we can see the sympathetic nervous system active occurs. So when sympathetic nervous system activity occurs, then renin angiotensin aldosterone system or RAAS system activated. On the other hand, the sympathetic nervous system, it acts directly on the kidney and it reduces the renal blood flow, and it also increase the water reabsorption from the kidney and sodium reabsorption from the kidney, but more water reabsorption. For this condition, what will happen in urine? In the blood, hyponatremia develop, but in the urine, what happens? In the urine, there is less amount of the water and less amount of the solute also, but more less amount of the water. On the other hand, when the RAAS activity activated, that means the renin angiotensin aldosterone system activated, it causes release of the renin angiotensin, first of all renin, then angiotensin, then aldosterone secretion occurs. And what they do, they also do the same mechanism. That means they causes a reabsorption of the sodium, reabsorption of the water from the renal tubule, and when the sodium chloride and water, they are taken from the kidney tubule, what happened to the kidney tubule, such as this is the collecting duct. What's happened? More water, more sodium chloride goes, so here is less amount of water, less amount of sodium, but there is high amount of waste material such as the urea, uric acid, creatinine, and other substances, other foreign substances, ammonia. So these toxic substances, they are released. So there is less amount of water, but there is the high amount of different type of the solute. So what will be the fate of the urine? The urine will be highly osmotic urine. That means the concentrated urine, it contains more amount of waste product than that of the water. And angiotensin 2 also, it increases thirst, so the patient intake more water. So what will happen in case of hypovolemic shock? In case of hypovolemic shock, what happen? As the sodium chloride water reabsorb, so there is less amount of water but more amount of solute, and in this condition a specific gravity will be increased.